As simple as it was, my good friend and colleague and a gentleman I worked for and with, Dr. Rod Raby, he walked into the clinic one day after being in an angiogram suite, and he was treating arteriovenous malformations with adhesive in people's brains, or in a certain subject's brain. And he walked into the clinic, he said, "Hey, I just did this case in the angio suite with adhesive fixing this guy's AVM. Why couldn't we glue veins shut together?" And I had this brilliant response. I said, "I don't know, okay." That was really kind of how it all started, just from his simple idea of using it in other places in the body, which it has a long history of use there. And so we progressed from there.
Venous reflux disease is a very common problem, and it is a disease where the valves in veins in between the muscle and the skin are not working. And what happens is when the patient or a person is standing, the valves open and they allow blood to flow backwards towards the foot. And what that can do over time is stretch out branches off of that vein and cause symptoms.
Well, I just had my third baby, so during my first pregnancy, I started experiencing quite a bit of varicose veins and pain, particularly in one leg, and it just progressed at each pregnancy. And by my second pregnancy, I knew I wanted to look to find treatment for my legs.
I thought that Jillian was a good candidate because I know that she's having quite a few symptoms in her leg and that she's very active. So she's a mother of 3 young children. She plays tennis. She doesn't want to take time off of her schedule of working out and caring for her kids. And so I knew that this would be of value to her, that she doesn't have to be wearing a stocking. She can get right back to her tennis playing and taking care of her kids immediately. And so I knew that this would be a very good procedure for her.
And so I came to visit Dr. Gibson, and we talked about treatment plans. And when she explained VenaSeal, that's the one I want. I gotta wait for this one, and I was planning on waiting until December to have the treatment. And I was pleasantly surprised that I could be here to do this today.
VenaSeal is an adhesive that is applied inside the vein that closes it instantaneously, essentially, or in one treatment session, and you don't need to use tumescent anesthesia. So with VenaSeal adhesive, we do not need to numb the vein up because it's not painful when it's happening. So the only spot where any numbing medicine is applied is the entry point of a little catheter that we slide inside the vein to put the adhesive in.
During the procedure, I felt a little bit of pressure in the incision spot, but other than that, there was just a little bit of pressure. That was about it.
Well, I think the fact that they don't have to have multiple needle sticks it will be comforting to them. You know, it's really not very uncomfortable. It's about like having an IV started. So for nervous patients, I think it will be particularly attractive.
I was excited, and it was really simple and easy, and I'm sitting up. I just had my procedure. I'm sitting up. I'm able to get up, walk. I mean, my purpleness in my legs have dissipated. I mean, it's wonderful. I feel great, and I can drive myself home today.